Hope all are doing good. And in this concise part 2, we'll be seeing mycology. And here, as always, we'll be seeing a classification first. So, classification of mycology, there is Thallophyta. Okay, that is basically it means that it has no stem, root, or leaf. And under Thallophyta, you have fungi and algae. Fungi, there is no chlorophyll, and algae, there is chlorophyll. And under fungi, there is Zygomycetes, Ascomycetes, and Basidiomycetes, and also Deuteromycetes, which is also known as fungi imperfecti. So, going back to the Zygomycetes, the some main features is that it is non-septate hyphae, and it has sporangiospores. Okay, they are asexual spores, and you have zygospores and oospores. They are sexual spores. And then Ascomycetes, there is septate hyphae and ascophores, and it is a sexual spore. And Basidiomycetes, there is septate hyphae and sexual spore is Basidiospores. And fungi imperfecti, there is septate hyphae, and it is medically important. So let's just have a look at again which is septate, which is not septate. Deuteromycetes septate, Basidiomycetes septate, Ascomycetes septate. So the only non-septate is Zygomycetes. Okay, and there's a asexual spores in Zygomycetes, which is known as sporangiospores. So moving ahead, okay, there's algae also. So the main heading I told, it was classified into fungi, there is no chlorophyll, and algae. So this has chlorophyll. And then talking about asexual spores, it is produced by mitosis. Okay, and there are two categories. It can be vegetative or aerial. Under vegetative, there is blastospores, arthrospores, chlamydospores, and under aerial spores, there is conidiospores, microconidia, macroconidia, and sporangiospores. I'll just tell again: blastospores, arthrospores, chlamydospores. Then under aerial, conidiospores, microconidia, macroconidia, and sporangiospores. Then moving ahead to lactophenol cotton blue mount, also known as LCB in short. So here the spores and hyphae are studied with this, and lactophenol blue. So what are its contents? As name suggests, it has lactic acid. Then phenol is also present, as the name suggests. Lacto refers to lactic acid, and then phenol, and then you have cotton blue. Okay, and then moving ahead, superficial mycosis. Under superficial mycosis, there is surface infections and cutaneous infections. Surface infections, there is Tinea vesicular and Tinea nigra and Piedra. So going to Tinea vesicular, it affects stratum corneum, and it mainly is concerned with discoloration of skin. And Tinea nigra, it forms black macular patches, and it is formed near keratinized tissues, that is mainly the palms and soles. Piedra, it has white and characterized as white and black nodules. So whatever forms white nodules is considered as white nodules and black. That's why it's named like that. And then you have hair. It also affects mainly hair. Then cutaneous infection. There is dermatophytes. Dermatophytes, it affects superficial keratinized tissue, and what it does, it breaks down the keratin, and it results in a condition known as dermatophytosis. And in case of hypersensitivity reaction, it forms dermatophytids. Then moving on to the classification, there is Trichophyton. This is classification of dermatophytes. Okay, so going to classification of dermatophytes, you have three main headings, that is Trichophyton, and then after Trichophyton there's Microsporum, and moving further after Microsporum there's Epidermophyton. So under Trichophyton some important things are Trichophyton violaceum, Trichophyton verrucosum, Menta, Graphophytes, Rubrum, Tonsurans, and going to Microsporum, you have Gypsum, Canis, Odoni, and then Epidermophyton, there's Flocosum. So these you need to memorize all this. 1, 2, all this, and then moving further, there is lab diagnosis. Lab diagnosis is mainly concerned with KOH, SDA, and LPCB. So what is LPCB? It is already discussed. Where is it? Yeah, it is lactophenol cotton blue mount, high phase post studied, lactic acid phenol cotton blue are the components. Okay. Then going to sporotrichosis. Sporotrichosis, there's ulcerating condition, and then skin and subcutaneous tissue are involved, and it also lymph nodes, and it's caused by Sporothrix schenki. And then it has yeast phase and mold phase. Yeast phase, there's cigar shaped cell, and mold form there is conidia, which appears as flowers. And then you have rhinosporidiosis. It's a common condition seen in the ENT department, and it mainly affects the nose and mouth, and it can also involve the eyes. And the Rhinosporidium seaberry is the cause of rhinosporidiosis, and it can be seen under H&E stain. H&E stain, it shows large number of endospores, which is located in the sporangia. And talking about opportunistic mycosis, there is aspergillosis, candidiasis, and mucormycosis, and also penicillosis. And talking about lab diagnosis, it's the same. You have KOH, SDA, H&E stain, PA stain, and lactophenol cotton blue, that is LCB, and precipitation test, antigen detection test, there is ELISA, and skin test. And talking about Raynaud-Broad phenomenon, it is nothing but the Candida, that is Candida albicans. It forms germ tube in human serum at 37 degrees, that is within few hours. So this formation of the germ tube is referred to as Raynaud phenomenon, and this mainly occurs in Candida albicans. And talking about mycotic poisoning, there are some important mycotoxins that are produced, and mycotoxins are harmful to the body, and the examples are penicillin rubrum. So it causes, as the name suggests, rubrum, it causes rubra toxin B, and then penicillium puerulum, it causes penicillinic acid. So you have penicillium, so it will again continue with that. So penicillic acid. And then there's Aspergillus flavus. Aspergillus species, there are so many, but you just need to know a few important ones. There are around 180 species, so we'll just do the important ones. So Aspergillus flavus, there is aflatoxin that is produced. And talking about other alpha Aspergillus, you have Aspergillus ocratius, it produces ochratoxin, and also there is fumigatus, Aspergillus fumigatus, which produces fumigatin. Okay. Then moving further, wait, I missed few. Yes, yeah. Amanita muscaria, it produces muscarin, that is the mycotoxin. And then there is claviceps species, which produces ergot alkaloids. Then moving on, there is this one, Fusarium nivae, it produces schiphenols. Then talking about dimorphic fungi. So dimorphic fungi, it occurs as yeast or mycelial forms, also known as hyphal forms. Okay, hyphal forms. And then systemic infections. Okay, histoplasma produces systemic infections, and examples. So we need to know a few examples also. Histoplasma capsulatum, Sporothrix schenki, Coccydioides hemitis, blastomyces, dermatitis, then paracoccidioids, brasilensis. Once you read this multiple times, you will stick it in your memory. Then here is culture. Culture, again same thing, it's SDA, LCB, and also brain heart infusion, and also chloramphenicol. Talking about chloramphenicol, it inhibits the extra growth of bacteria, and cycloheximide, it prevents unwanted growth of the fungi. Then talking about a hyphae, in particular hyphae, there is many types depending on the shape. There can be spiral hyphae, there can be racket shaped hyphae, there can be chandelier type hyphae. Okay, and then there is also KOH. Using KOH, these characteristics are mainly seen, and then KOH along with calcofluor white, these characters, they appear fluorescent. Okay, then moving on to systemic mycosis, there is blastomycosis, histoplasmosis, coccidioid mycosis, paracoccidioidomycosis, and cryptococcosis. Okay, then talking about cryptococcosis, I think this is the last but one topic. There's just one more. Okay, so talking about cryptococcosis, there is Cryptococcus neoformans. It is the main organism causing this. It is a soil saprophyte, capsulated yeast. It is gram positive. It is mainly stained first by nigrosin or India ink staining, and then it leads to medical conditions. Why should we study this? It leads to medical conditions such as pneumonitis, cryptococcal meningitis, which is a main important feature of cryptococcal meningitis, and it is mainly seen associated with HIV patients. Then going on to lab diagnosis. So lab diagnosis of a cryptococcus patient, what you need to do is, firstly you need to take the CSF, you can take the pulse also, you collect sputum, urine, and also brain tissue are collected, and then as mentioned earlier, it can you put nigrosin and India ink, and then going to the culture, you can do it with SDA, LCB, PAS, and HNE stain is also used, and mascaramine stains are also used, and growth seen in also niger seed agar can be used. Urea test can be done. This is all with respect to cryptococcosis. Okay, that is cryptococcus. As mentioned earlier, PAS, HNE, mascaramine stains, SDA, LCB, PAS also I was mentioned earlier. You can just go rewind and see. PAS stain, I used it a few times. It's nothing but periodic acid Schiff stain. Okay, periodic acid Schiff, that is PAS. And then there is animal inoculation test, latex agglutination test, and then last we'll be seeing aspergillosis. Aspergillosis, there's Aspergillus niger, as mentioned earlier. There are 180 species, and we'll just deal with some important ones as mentioned. So there are Aspergillus niger, flavus, fumigatus. These are the three main important ones. Okay, and then there are others. You can just go through. Nidulans, tubengensis, and others mentioned here. Okay. Then going on to the diseases it causes. Aspergillosis, it can cause bronchopulmonary aspergillosis, that is concerned with the lungs. And then aspergilloma and Aspergillus asthma also seen. Then going on, it also causes otomycosis, mycotic keratitis, and also sinusitis. Then laboratory diagnosis, what is seen? Well, firstly, bronchoalveolar lavage, and then sputum is also collected, and as mentioned earlier, use of KOH, HNE, PAS staining. As mentioned earlier, what is PAS? PAS is nothing but periodic acid Schiff. Okay, PS is staining, periodic acid Schiff staining, and then SDA, that is Sabrauds, dextrose, agar, and LCB, that is lactophenol, cotton blue. Okay. Then for staying tuned with the latest updates, please subscribe, and if you like it, give a thumbs up. Thank you.